All right, so welcome everyone. Thank you all so much for joining us for another session of Reimagining Mobility with UW Create. My name is Kat Steele, and I'm an associate professor of mechanical engineering and one of the associate directors of Create here at the University of Washington. I'm a white woman with long sandy brown hair, and today I'm in my basement with a blurry background of a brick wall wearing my purple UW scarf to try to stay warm. I'll also let my co-host, Heather Feldner from Rehabilitation Medicine, introduce herself.
Good morning, everyone. This is Heather speaking. We're so glad that you are joining us today. My name is Heather Feldner. I am an assistant professor in rehabilitation medicine and also an associate director of Create. And I am a white woman and I have short gray and brown hair. I'm currently wearing my dark rimmed glasses. I have a set of white headphones on, and I am wearing a very cozy gray turtleneck sweater. And in the background is my living room with some furniture and pictures on the walls.
Cozy seems to be the word of the day. Well, thank you again, everyone, for joining, and I hope you are cozy as well. This series of seminars is being hosted by Create, which is a center at the University of Washington, focused on research and innovation to both make technology more accessible and using technology to hopefully make the world more accessible. Before we begin today, I do have a few logistical and accessibility notes. We do have captioning and ASL interpretation today, and especially thank you to our interpreters, Teresa and Tammy. We will pin the interpreter videos to ensure continued access between speakers. And to access the captions, click the CC on your screen. And you can also view the live transcript on the side. Message us if you run into any issues. And this meeting is being recorded and will be posted afterward along with a printed transcript. For self-care, we do ask that you do whatever you need to participate and engage in this session today. In person, we would invite you to move around, knit, fidget, take notes, draw, or just listen. And virtually, we will invite you to do the same, as well as to participate with your video on or off. Participation can be demonstrated in a variety of ways, both verbal and non-verbal. And you can especially use the chat box. And when we have questions and answers later, you will also be welcome to raise your hand to unmute to ask a question as well. We do ask that you remember to mute your microphones when not speaking. Looks like that's great across the board right now. And we also want to recognize that accessibility is an ongoing learning process. And so if there's anything that you need, message us and please let us know how we can improve for the future. So without further delay, I'm really excited to introduce our speaker this morning, Yochai Eisenberg. Dr. Eisenberg is an assistant professor in the Department of Disability and Human Development at the University of Illinois at Chicago, an affiliated researcher at the Great Lakes ADA Center. He studies the ways in which neighborhood environments, policies, and systems impact community mobility, health behaviors, and health outcomes for people with disabilities. And he uses a really unique blend of big data, policy, and community engaged research, which is one of the reasons we were really excited to have him here today. One of the things we love at Create is how interdisciplinary his work is, and it really reflects his unique training across public health, urban planning, and disability studies. Yochai is also a collaborator with one of our Create associate directors and our speaker for our next month's conversation, John Freilich. And so hopefully we will also see some bridges and connections being built there. So with that, I'm really excited to introduce Dr. Eisenberg and turn it over to him for a brief presentation, after which Heather and I will lead off with a few questions and conversation. But then we do want to save a lot of time for audience Q&A. So be thinking of your questions. And if one comes up that you don't want to forget, feel free to type it in the chat and Heather and I will keep track of it. So welcome everyone, and over to you, Yochai.
All right, thank you very much, Kat and Heather. And thanks to everyone for this opportunity to present to you about my research and work over the past 5 or so years. And I just describe myself. I'm a white, middle-aged male with short brown hair. And at this time of year, not all times of year, but at this time of year, I have a pretty fuzzy beard that helps keep me warm in the Chicago weather. And yeah, Kat shared a little bit about where I'm at. And a lot of the research that I'm sharing is funded through NIDLR, the National Institute on Disability, Independent Living, and Rehabilitation Research. I hope I can give you some new perspectives on disability and community mobility. I know a lot of you come from a wide range of backgrounds, which I'm really impressed by, and really think I wish UIC had some kind of center like this with the diversity of disciplines that the Create Center has. So yeah, I know some of your work is oftentimes probably at the individual level, examining ways that you work with individuals. And hopefully this is a neat way to kind of stretch that out for you to think about that in the context of communities. So I wanted to start off with just showing a map of, well, I wanted you guys to guess. So if you could take a look at this and see and try to guess what this is a map of. I will read the locations on this map. We have 10 or so cities on here. And let's see if anyone can guess what this is a map of in the chat, or if you'd like to just shout out. We have Seattle, Sacramento, San Francisco, Los Angeles, Denver, Kansas City, Chicago, Atlanta, Philadelphia, Baltimore, and Boston. Okay, good. I was hoping someone would put in a chat before I finished. We have the United States cities. We have ADA centers. There's some good guesses. These are all, any other guesses? Nope. These are all places, large cities, where there has been recent ADA lawsuits within the last, I'd say 5 years, and several of them over the last 2 years. And I think this just shows how expansive and widespread the problem of pedestrian barrier inaccessibility is, as well as how urgent it is, right? If all these very large lawsuits and settlement agreements are set up, clearly there's something that's not working out here, not working well. So what I want to talk to you about today was focus on these pedestrian environment barriers, talk about why plans for removing barriers are needed, talk about some successes and challenges for planning for barrier removal, and as well as using technology as a catalyst for planning, and wrapping up with a few ideas for further questions to explore. Okay, someone was involved with one of the ones at UW too. So yeah, those don't include all the other cities. At some point, it'd be neat to have a map with all the cities and the dollar amounts as well. Click over here. So as a background, you may be aware pathways for walking and wheeling are critical for people to get to the places they want to go and to be a part of the community. However, pathways that are broken or are not built in ways that are easy for people with disabilities to use make walking or wheeling difficult. And on this slide, I have an image of a curb cut with a corner with no curb cut and a badly broken sidewalk. Now, part of the reason that pedestrian infrastructure is also important for community mobility is that many people with disabilities use this infrastructure. And actually, looking at some recent data from the National Household Travel Survey, more people with disabilities, a higher percentage, not necessarily more in number, but a higher percentage, use the pedestrian infrastructure than those without. 13% walk as part of their travel in the community, compared to 9.2% of people without disabilities. And for transit, it's 4.3% versus 2.7%. Now, what's the relationship with these barriers and mobility? So part of the way the literature has described it is that pedestrian barriers disable people with mobility limitations by affecting self-efficacy in walking or wheeling, limiting perceived walking and wheeling destinations, and reducing trips to physically challenging or unsafe environments. There's an image here of a man using a cane and walking on the sidewalk. Now, these barriers also affect community participation and in participating in activities that could promote health, such as going to the fitness center. There's an image of a person in a wheelchair using an arm ergometer, and the same image of the person with the cane walking in their community, as well as accessing food. There's an image of a woman in a wheelchair shopping for fresh fruit. Now, all these relate in what I like to talk to my undergraduate class about in a socio-spatial process. And this is a very simple model of that. Obviously, many models of disability become very complex, but I think it kind of incorporates some of the basic elements that we think about when we think about the socio-spatial process of disability, where we have the built environment over on the right side. Here, we start off there, and as kind of a very crude way of showing a building or landscape. And what you see there is the built environment affects, an inaccessible built environment affects access and mobility, creates this lack of access and mobility for people with disability. And this lack of access and mobility affects community participation and results in a lack of community participation and employment among people with disabilities. That lack of community participation in turn affects societal views of disability. And we know as well that those societal views, past and present, affect the current environment and future planned environments. Now, part of the aim with much of the policy and law over the past 50 years with the 1973 Rehabilitation Act and the ADA in 1990 was to make an impact on the built environment and to change the accessibility of the built environment, as well as societal views of disability. But we lack an understanding in some ways about these arrows. I should probably have made both arrows kind of fuzzy, right? Because there's a lot that we don't know about how the ADA has impacted the built environment. We know about the requirements, but we don't necessarily know about what has changed. And part of that change is the planning and the implementation that goes into that change. So I drew a kind of zigzag dotted line from policy and law to the built environment. So how much of a problem are barriers in the pedestrian environment? Our research found that 65% of curb ramps and 48% of sidewalks were not accessible in a sample of US communities that we looked at. More recently, in relation to the lawsuits I just shared, it was cited that 97% of curb ramps in Baltimore were inaccessible, 91% of curb ramps in the state of Oregon were, in the state of Oregon's DOT maintained curb ramps were inaccessible, 50% of Boston's curb ramps, and 80% of Atlanta's sidewalks. And a lot of these numbers come directly from communities who have to do these assessments and are giving these numbers. But the problem is that many communities since the ADA and over the past 30 years, we're trying to push these barriers behind a closet, kind of like this little graphic shows as a person trying to stuff all their junk in a closet and it's popping out and bumping away. That's kind of how things are going with the way that barriers have been treated, pedestrian barriers, and they're clearly not going away. And so the problem is not just that these barriers exist, but there's a lack of progress in barrier removal. And there's no doubt that progress has been made, construction has happened over the last 30 years, but clearly the rate and pace of that progress is not sufficient based on these numerous class action lawsuits, along with the literature that has explored barriers that people with disabilities experience. There was some great research by Dory Rosenberg, who was at UW or still maybe, in relation to some of those built environment barriers. And so essentially, you have most communities have these barriers, it's clear. And one option, I have a little graphic here with a square for barriers. And one option is that it leads to lawsuits and settlement agreements. And it's clear that that is likely an inevitable outcome. Or the other option is developing a plan, being proactive and developing a plan for barrier removal. And this is something that has really grown exponentially. If you look at a kind of curve of these plans over time, the last 10 years, they've really gone up a lot. So what is a barrier removal plan? In more technical terms, it's called an ADA transition plan. This was required under Title II of the ADA, and at that time was intended to be completed 2 years after the ADA was passed. It was intended to provide an understanding of the current conditions through an inventory, and then lay out a plan for improvement, which would include how, the methods for that barrier removal, when, a schedule, who would be responsible for making that improvement, and then what were the priorities, which were listed that were required to have public participation from people with disabilities. The research gap that we tried to address was that although the ADA was passed in 1990, we lack an understanding of the progress made in planning for and implementing these changes. So think back to that arrow, we just don't know what that arrow looks like and how much of an impact it's making. And so this is a citation for the study that we conducted. That was a systematic evaluation of these plans to explore where communities were at. And I want to just share some high-level findings. I did share these statistics already, that 65% of curb ramps and 48% of sidewalks were not accessible. But also in terms of actual plans, right, which come before, only 13% of communities were accessible, but had plans for pathways. And what was more worrisome is that the quality of those plans were not strong. Many communities did not meet some of the basic requirements, or did not have some of these quality indicators that we had developed for good plans. And this is important, right? Because plans that are low quality are not very likely to be effective in making pathways more accessible. We found similar results in the Chicago region. We worked with a local planning agency here. They were interested in looking at this very specifically in the Chicago region, and we found very similar results. Only 11% of communities had plans, and most were low quality. And the name of this report was called Where the Sidewalk Ends, the State of ADA Transition Planning for the Public Rights of Way in the Chicago region. So the takeaway from our systematic evaluation, I'd say, is that communities in the US do not have strong plans for building accessible pathways. And there's this need for meaningfully involving people with disabilities so that transition plans can help cities and counties, various governments, develop plans and prioritize community locations that actually matter to the people that they're hoping to impact. And so local governments have this need and actually a requirement, we clearly see that, for developing or updating their plans and developing some concrete details and timelines that can improve the infrastructure so that people with disabilities can get around their communities. Now, after we learned about this lack of planning, one of the things we wanted to look at was whether the plans themselves are showing some impact, are having some relationship with the physical environment itself. We just sharing a preliminary study that we did, an exploratory study that looked at whether communities with ADA transition plans had more accessible infrastructure than those without. This was our cross-sectional street level imagery analysis done before I met John Froelich, and I hope to repeat this after our work and our study that John and I will talk about in this presentation and later presentation too. In this study, we looked at the communities in the map shown on this slide. The communities in orange are those that had transition plans, and we developed a matched sample based on the urban design, population density, and income levels of communities. We used Google Street View and aerial imagery and had trained raters do virtual audits of these matched pairs. What we did is focus on the areas around city halls, because these are typically one of the highest priority areas that a city is, according to Title II, required to make accessible at first. So ideally, these are the most accessible parts of a community. Again, this was just exploratory, so it obviously doesn't cover a lot of the different aspects, a lot of different areas and designs of a community. In the images here, we're just showing that two of the methods that we used. One was to look at just create these circular radii to find the nearest infrastructure. And then we also looked at the path from the nearest transit stop to the city halls. And that's shown here in a red line going from little bus icons to the main entrance of city halls. These are some of our results where we show that the accessibility scores for communities with plans were in fact higher than communities without. We broke this out by curb cuts, crosswalks, pedestrian signals, and sidewalks, and then combined those as well. And the way it's laid out is each of the features is representing two columns, and then there's communities with and without transition plans next to each other. I'll just read off the means of these scores that for curb cuts were 0.82 for communities with plans versus 0.73 for those without, 0.81 versus 0.74 for crosswalks, 0.66 and 0.56 for those with pedestrian signals, 0.86 versus 0.74 for sidewalks, and 0.80 versus 0.72 for those with for total. One thing we did find though is we did not find a relationship with having a higher quality plan. So we have this tool for rating the quality of transition plans, and we did not find a relationship with the quality of those plans and accessibility scores. Part of the reason and complication with this whole study, in fact, is that many of these plans, like I mentioned, are fairly recent. And because of that, we also think that it's a little bit hard to detect differences when there hasn't been that much time elapsed since the plans were developed. This is another graphic just showing our results. It shows the path scores from the city hall and the transit. On the left side are the paths for no transition plans, and on the right are for transition plan communities. And what we're showing is these lines with purple squares that represent low to high accessibility scores. And the darker the little purple squares are, the lower the accessibility is. So essentially representing barriers. And what we wanted to show here is that having a score in itself doesn't necessarily tell the whole story, right? Because even if there are a smaller number of a fairly high total score for a path, there could still be these important barriers that could limit people with disabilities from using those paths. And it shows that in both communities with plans and those without, these barriers exist. And I'd like to essentially, I think, show the long work that needs to happen in communities. The last area that I'm going to talk about is how communities have successfully developed and implemented ADA transition plans. After we learned that so many communities did not have plans, we also learned that several communities did have plans that had high quality plans. And so we reached out to our various partners around the country to identify those plans that they recommended. And then we tried to talk with the the leaders of those plans, those who created the plans, to learn how they did it. What does it take to make a good plan that is set up well to be implemented? And so our questions were looking at what community, organizational, and interpersonal factors supported the development of higher quality ADA transition plans for pathways. What we did is, like I mentioned, identify these high quality plans. We recruited ADA coordinators and actually teams. One of the things we found is that these plans are often done in teams of 2 to 6 people. One of the interviews was with, and conducted 1-hour interviews using a structured interview guide. We then recorded, transcribed the interviews, and then organized the findings using a template that other researchers had developed to study successful practices that organizations use to develop plans effectively, and what researchers call validated categories. So instead of kind of developing categories of our results, we use this framework that some of you in rehabilitation or medicine may be familiar with, but it's really less used in the planning and let's say architecture world. It's called the Consolidated Framework for Implementation Research, or CFIR. And it helped us organize these policies that ADA coordinators talk to us about, and think about, what are the best ways to have and create a plan. So here's go through the findings here real quick. Not too quick, but just so we have time for more discussion. So what we found after talking to ADA coordinators is, first, that what makes a successful plan is that the organizational change is in terms of the local government as an organization needs to change to build support and buy-in for the plan and its implementation. Here's a quote from one of those ADA coordinators to explain a little bit more about what does organizational change mean. They say, it's not just a block on a checklist, right? That's not what the intent of the ADA is, in my opinion. It's a complete philosophy change in the way that we look at and treat other people. It's a sense of awareness that someone who might have a disability still has the same rights and accessibility to everything that we provide as a city. And so that's speaking to the way that people within the city view disability and somewhat of a culture change within that city. As well as somebody talking about how it's amazing how a 30-year-old law requires so much handholding and educating. But yeah, that is consistently being reinforced. And this isn't just about having one speaker with a disability or even just hiring an ADA coordinator. It was described as this overall change in how disability is understood and valued, and that this educating was unfortunately something that needed to consistently happen as people changed, right? In local government, the mayor changed, different heads of departments are constantly changing. And as that happens, it could stifle the progress and process of understanding of the importance of disability within the organization. Another important piece that people talked about was the involvement of people with disabilities as a key part of their plan. Now, because again, we chose communities that had good plans, part of the criteria was that they involved people with disabilities. We wanted to learn more about how they did that and what worked well. So here's an example that someone shared. They're instrumental in helping us in developing the plan. We communicate to them what the plan is, and where they are really got into the meat of the plan was how we're addressing our barriers in our transition plan and what we're prioritizing. And so this is an example of how there's oftentimes in the plans that do it well, they have a disability advisory committee. And in this case, the person being interviewed really valued that committee and engaged them in the process to arrive at the priorities. Unfortunately, this is, again, something that does not happen very often. And part of it is, kind of a lack of, in a sense, valuing public participation, but also, I think, not necessarily knowing the disability community well enough and not having those connections and partnerships with the disability community that are needed for making a good ADA transition plan. The experience and training of ADA coordinators was also important. Someone shared, I understand it. I grew up near Berkeley, so I know about the independent living movement. This coordinator had a long history and thorough understanding of disability. And, that really set them up to do effective work in developing this plan. But one of the things with local governments and the way that ADA coordinators are set up is that they can be really different in each community. So one community, it's this person who their only job is an ADA coordinator. In other communities, it's also an engineer. It's also the city architect. It's also sometimes the city lawyer, or sometimes even the HR coordinator. And because of that diversity and those differences, people have, much different levels of being ready to develop a plan and being at this stage of readiness for developing a plan. So I'm going to skip over this last finding just so we can make sure we have time and skip to the kind of next steps that we are looking to do as part of our ongoing research. Is that we want other communities to learn from these successes that we shared, and we're going to be developing various dissemination tools for that through internet and case studies. And our aim is for more communities to use these successful practices that were identified and to develop more high quality plans that, this is how they can effectively result in more accessible communities. So some further thoughts that I wanted to share. We're also, or maybe complications, kind of circling back to where I started, was, the importance of progress and understanding what progress is. But part of the, I think, complication now going forward is how can we know when enough progress has been made? What kind of measures might we use to understand that, and how could we potentially try to standardize that in communities so that progress is not something that's forgotten about, but that can really, disability advocates can really keep track and push local communities to make sure that they're doing what they need to do. How do we know when involvement of people with disabilities is meaningful? This is something that we also are going to be researching in our future work. And then, one question I thought of in terms of potentially folks who work, again, more at the individual level is how do we understand all this in the context of an individual? How might someone who's working in rehabilitation understand it and what it means in the context of an individual? And I think, that maybe that's part of what we could discuss. One of the questions that I thought of was that, people might think about, do local governments remove barriers for individuals? And, what I would say to that is yes and no. It really depends on the local government. There was someone who contacted our center from a suburb nearby, was very frustrated. Their father had I think it was a stroke, and was going through rehabilitation and wanted to be able to go and walk outside. But there was no sidewalk in that community. And this person was interested in understanding the zoning laws and policies around that and what could be done, and was receiving a lot of pushback from the community who was in charge of the sidewalks there. But clearly there was an interest and need from the person who was undergoing rehabilitation. In other communities, they're very responsive, and sometimes if someone brings up an issue at a curb cut that needs to be fixed, they do have the capacity to fix that, maybe in the near future or within a year. But that really depends. And one of the best practices that we learned about was, having a fund set aside for being able to take care of some of those barriers that are not planned for, and that, may come up and be really important. So that's where I'll leave us. Going forward, we're going to be very excited to be working with John Froelich and the Project Sidewalk team. Our study that we were awarded recently is called Crowd and AI Tools to Map, Analyze, and Visualize Sidewalk Accessibility for Inclusive Cities. And so that's marrying computer science with all this ADA transition work, applying it in the real world. We have some very engaged partners who want to use these tools to develop ADA transition plans and work towards building more accessible infrastructure. All right. Hopefully that gives us a good amount of time for discussion still.
Excellent. This is Heather speaking. Yochai, thank you so very much for this really interesting and very important talk. I'll just invite our participants to show their appreciation for you, either with applause in whatever way that is communicated. You can use your little emojis or show on camera. Thank you. So we would love to open it up for discussion and questions to the group here today. And so would again just remind all of you participating to feel free to have your camera on or off, to use the chat feature to type a question, and we can facilitate reading that out loud. Or if you'd like to use the raise hand feature or just jump in with a question verbally, please go ahead and do so. And while folks are thinking of their questions, we can start off with one. And then I also just wanted to point out that for those of us in the Seattle and the UW community, I did post in the chat, our University of Washington Seattle campus ADA transition plan was just compiled last year. Okay. And released. And so that document is in the chat. It's yeah, just a great reference and in terms of the information that we're talking about here today, and Bree Callahan, who's our ADA and Section 504 coordinator, has been really responsive to getting this undertaken in kind of, I think, part of dealing with some of the lawsuits that came through with the Seattle area as well. So that is posted for anyone who might be interested who is locally here. And so I'll start out with a question for you, Yochai. I would love to hear your thoughts on some of the different challenges that you've seen in your work when considering a really urban environment, like the city of Chicago, and maybe more of a rural or suburban environments. And have you seen any patterns emerge in terms of some of the different challenges that with barrier removal?
Yeah, definitely. I think, for cities, probably anywhere beyond rural, the challenge becomes the enormity of the scale of the infrastructure that, becomes thousands and thousands of sidewalks and curb ramps that add up, and that, you're looking at in terms of inventorying and determining whether it's accessible and how to prioritize it. So that just enormity of it, I think, stifles people. And then, it also is the, in terms of, I guess, urban and rural, for rural communities, like there's less infrastructure, right? And so we have seen some examples of communities that actually have made a lot of progress. And one community we interviewed stated that they have made all their curb ramps accessible, 100% curb ramps accessible, but it is a rural community. And when I looked at it on a map, because of the ADA, only the curb ramps that are there, only the sidewalks that are there need to be accessible. And that doesn't mean that it's necessarily a safe environment that someone can get from A to B in that environment, because there may not be a sidewalk there, but the city is not required to make anything accessible because there's no sidewalk and there is no curb ramp. So there's this tension a little bit, I guess, with, kind of just pedestrian infrastructure more broadly, pedestrian safety, and the way the ADA is designed and what's required. David?
And then we'll turn it over to Dr. Morgan Droth, who just raised his hand. So if you want to unmute.
Yeah, thanks, Kat. Yochai, really enjoyed your talk. I'm a physician, a physiatrist, and also a scientist working with folks with limb loss a lot, just so you know where my perspective comes from. So my question for you is, I'm wondering if with the data that you're showing, if you have a sense of how pedestrian accessibility, for instance, varies across regions, even within a city, specifically in sort of high income versus low income, or communities of color versus communities with, that are primarily white. And I guess secondarily, given that there's tends to be a lack of infrastructure in those areas at baseline, sort of what the additional challenges, and if there's a focus on those particular areas and communities.
Mm-hmm. Yeah, no, great question. I think there definitely is that variability. I've seen it in communities that have done a detailed infrastructure review. Again, not all communities have, but those that have, you're able to see a map of that distribution of accessibility. And I'd say for the most part, it seems quite widespread, that there are accessibility barriers everywhere, but that in low-income communities, there are likely more barriers. I've seen that some communities do set up these prioritization schemes where they look at the income level of, let's say, a neighborhood or census tract, as well as how it enables potentially access to transit, and then racial, not so much racial characteristics, I would say. I don't think I've seen that, but partly I think the communities that are sharing that is pretty few and far between. I think some of the work that John's doing is going to enable that, linking the sidewalk accessibility data to more population characteristics. With that said, in terms of what happens when if you see those disparities, right? What happens? I think the key there is the prioritization. What gets prioritized? What gets planned? And that's what'll get done in a way. And so I think being able to intervene at that prioritization level is key, because we know, coming from Chicago, the windy city is not because it's windy, right? It's because of the politics. And the way that improvements in the physical infrastructure happen here is that aldermen have a budget and they're in charge of it. And the way that they spend it is not according always to who needs it and where their actual priorities are. And that's going to be different in every community, but that process is really important. I think that's another reason why these plans are important, because it's something that advocates and scholars and researchers could point to and say, how well are we meeting these guidelines? Where are the improvements happening? Thanks.
Thank you.
Fantastic. We'll turn it over to Patrick next.
Yeah, so first of all, thank you for this wonderful talk. And I just had a kind of a two-part question, because I work for a Center for Independent Living here in Grand Rapids, Michigan, and we're doing some of this pathway work in terms of working with our downtown and taking individuals with disabilities in downtown Grand Rapids and really taking pictures and noting sort of different hazards and making notes. Although now we've got all of these pictures and we're working on ways to sort of formalize the findings. And so I guess a first question would be, are there certain ways you talked about the enormity of the infrastructure data. Are there certain ways of, I guess, organizing that or presenting that you've found effective with cities? And then also, as sort of a related question, we're also looking at, how do we build out, is it an accessibility council that would review ongoing concerns? So are there sort of those kinds of infrastructures within cities that you've found effective?
Great question, and really neat to hear about your work. I hope if you're interested, I'd be interested in following up to hear more, really. Because it sounds like you're working with a community group to do. You work for a Center for Independent Living. You don't work for the government, and so you're kind of doing this collaboration, which is great, which we don't see as much. And I think, in a sense, in terms of how you present the work and organize it, what we've seen in the transition plans is, let's say they go through a whole part of the city, or they go through the whole city, and then they develop some criteria for prioritization. I'm not sure if you've done this already, but it sounds like you may have identified, in a sense, a priority area being the downtown area as potentially a place where it's quite important for people with disabilities to have access. And so, in some ways, you've kind of started with that. And then, I think partly in terms of organizing it and presenting it, it's understanding how, in a sense, who the end user is and how they're using that data, right? And so when the local governments are the ones doing it, they are sometimes thinking about this, but they are hopefully trying to think about how that can then be used in their planning and scheduling. And so I would have that conversation with them to know, what is the best way that we could organize this data, and develop that prioritization criteria, and then be able to put different features into different priority criteria. So then you could look at that, and there's ways of looking at that both tabularly and through maps, right? And
Yep.
people do love maps. And I'll give you one example of a neat place that I thought did really well with their plan is Tempe, Arizona. They used what's called an Arcgis Story Map, and made and if you email me, I can share with you the link. But they use that both to gain feedback from people with disabilities, as well as to show the priority areas and show their process. So as a way, for the disability community to say, hey, what's going on with this? I want to see something. And that was on their website as a dynamic interactive map.
That sounds awesome. I'll certainly reach out to you afterward. That'd be great.
Great. Thanks, Patrick.
Thank you.
Yeah, thanks, Patrick. Makes me want to get back up to Grand Rapids. That sounds exciting. Deborah, you have your hand raised.
Hi, Dr. Eisenberg. Thank you so much for your talk. I was just wondering if you're familiar with Dr. Lawrence Frank's work. He's at the University of British Columbia. He's a... Oh, you are? Yeah.
Yes, yes,
yeah,
definitely.
So...
Yeah, like you got to cite him if you're doing anything with sidewalks in an environment.
Yeah, I just wanted to mention he has linked reduced chronic disease to increases in just sidewalk walkability, and he's worked a lot with the mayors and a lot of the political leaders there to get a bike lane in, and that's been done, and just make the city a lot more walkable, really. So yeah, anyway, I'm glad that you're familiar with his work.
Yeah, I'm not familiar with those case studies, those of maybe that city that you're talking about. So
Vancouver, British Columbia.
Right. Nice. Great. It'd be great to learn more about. Thank you. And I think, what's with the walkability measurements, right? The ones that most of the public health researchers use, those often don't incorporate these aspects of accessibility. They're using within those indexes or measurements, they're often about distances and how many destinations are nearby, but they don't get at the accessibility of those sidewalks. And so, yeah, that's what I think is needed. And then once that's available, I think that relationship to the health of people with disabilities and older adults could then be examined.
Absolutely. Thanks so much.
Thank you for the question.
All right, I'll get to jump in and ask my question now.
Okay,
I really like how, you're looking at the transition plans and, zooming in on individual communities to see like how that impacts participation. Now, in our last talk, Karen Breitmeyer shared like some really cool examples of like new buildings, in lots of different cities. So my question is, how are we doing on the like new building built side? Like, are the ADA transition plans and other things providing good guidelines for new buildings going forward that can both like enhance those while also provide ideas and inspiration for modifying environments as well? Is it a good feedback loop?
So you're saying like, are you talking about buildings specifically or the building of pedestrian infrastructure?
Either one, like we just opened a brand new set of light rail stations here in Seattle. Like, are we, are we learning from our past experiences and creating better built environments that won't require future ADA transition plans?
Right. Yeah, no, that's a great question. And I think, in some ways it's an issue of things being built in silos, right? And there's different reasons that new transit stops get built and different reasons why a private building gets built or an institutional building gets built. And a lot of those designs could be done very well and universally designed, but they don't always have the connectivity piece to them. So the transit stops, maybe the immediate block around it has very accessible sidewalks and curb ramps. But as you cross the street, there's a very bad curb ramp and very bad sidewalks. And so I think this connectivity issue is kind of critical because it gets to the real world of what someone would experience trying to get from that transit stop to where they work or where they live. And this can be really tricky. We found one community, it was Bend, Oregon, who we talked with in our interview. They have a really good ADA coordinator. And one of the ways that they were talking about prioritizing things was connectivity. It wasn't necessarily, right in front of this building or right in front of that building. It was about setting up these paths and connectivity priorities for that would enable, if you think back to the slide I had with the paths, right? And so, in some ways you're kind of like turning some of those purple squares into lighter purple squares, but there's still these barriers along the way. And so I think kind of thinking about connectivity as a priority is it's a little challenging because you need some of the data and you need a way to develop those origins and destinations. But I think it could be an important way to think beyond one building and maybe what you're talking about, get to urban accessibility and having that. Yeah.
Oh, thank you. Murray, over to you.
Yeah, Murray Maitland, Department of Rehab Medicine, and I've been on the Faculty Facilities and Services Committee for about 8 years. And I just want to talk to Kat's statement about, how is it changing, and about the moving targets. So basically, it has been changing for the better. We have so many legacy issues with this campus being built over 100 years old. A lot of people are even working in seismically unstable buildings and there's no money to fix those. So we have a lot of challenges being in this older built environment. And we're learning, but an example would be the computer science and engineering building that was just built. It's still got issues. And now the new engineering building, as we had a meeting about it and we do have our ADA coordinator working with it. But of course, who do they interview as stakeholders but the able engineering students and the able faculty members? And it really speaks to this problem of getting those people who aren't voices in the room, to go and seek them. So I would say it is a moving target though.
Yeah.
As we learn, we're getting better, but then you have to go back and revisit all these things and everything costs money. So, and I would say, and I think you spoke to that a little bit, that it is about money. But here's my question. How do we get it to a point where we don't have a moving target anymore? Yeah. So we can build these things for longevity, which I hope is where Kat was going with this.
Yeah. I mean, That's a really broad question, because it's partly making me think about the materials, right, and the design of the sidewalks and curb ramps. And it's funny because it makes me think of, there's a curb ramp right near our building that, like, I swear it gets replaced every year, and it's because it's right near a hospital and the ambulances go over it all the time, and so it's constantly being needed to be replaced. But I don't know that it'll ever be. What I would say is that, like, infrastructure in general will always be a moving target, right? That there's always going to be this need for improving infrastructure. I think part of what you're saying in terms of getting the design right comes back to the education of both the local government architects and engineers, but then also the folks who are implementing it. One of the things that we heard about from Oregon conversation was the need to go out after something is constructed and evaluate it, and that because of the fact that oftentimes something might be built but not necessarily to the requirements, and so I think it has to be this flow of information on what's required and what's needed, but then in terms of thinking about what is the target, which to me is what is a priority for people with disabilities in that community. And I think the key to that is having a pulse, having the engagement with people with disabilities, to know what the target should be and where those priorities are, so that you may not always, there may be this need to update things along the way and at different times, but if you have that target in mind, that you'll be, in a sense, fulfilling the goals of the ADA, not necessarily of having the perfect design and perfect compliance, but fulfilling some of the goals of the ADA for enabling equity and non-discrimination. But I don't think we always have performance measures like that, where we are going back to the disability community to learn about how mobility may be improving, how access may be improving. Those are some of these broader evaluation measures that I think need to be linked and measured along the way. So thanks for that question. Yeah.
Makes me want to get to work as an engineer and designer.
Yeah.
All right.
Definitely. Yeah. Why can't the sidewalks be like some kind of plastic material that's like the parks and is rubbery but falls apart probably. I'm not the engineer.
I've been back chatting with our next speaker, but I'll let Heather close us out on, what types of data and things can we do? So many exciting ideas. All right, Heather, over to you.
Absolutely. Yeah, I just want to thank everyone. We are at time. I might try and sneak in one last little question, but wanted to acknowledge that for those of you who are jumping off the call right at 12, to once again thank Yochai for all of his expertise and sharing his research and work for us. Thank you so much for being a part of this conversation. And for anyone who is interested, our next series is going to be with John Freilich and Annette Caspi. And I'm double checking the date here, but I want to say the December 11th. No, December 9th and 10th are those event dates. So we will be sending out invites, reminders, and sign up reminders for those as well. But it will continue this conversation on urban accessibility and what we can do within our built environments. So thank you all again for being here, and thank you to our interpreters, Teresa and Tammy, as well. I guess to close out, for those of us who are still on the call, what I would love to hear your perspective on is how these transition plans are also bringing in and accounting for needs related to sensory disabilities or invisible disabilities. I think it's kind of our default when we think of the built environment to think about physical disabilities. But there's also very, real access needs for folks who have invisible or sensory disabilities. So I was just wondering if we could maybe end on your thoughts on that.
Yeah, for sure. Definitely. I think that's definitely what we see as well, kind of like just the focus on the curb ramp and just the sidewalk alone, right? And part of the ways that the ADA is so very specific about the design guidelines for that kind of lead to, I think, the relationship to focusing on people with mobility disabilities for the most part. And then maybe second, people who are blind and low vision related to detectable warnings. And more recently, the pedestrian audible signals, which the city of Chicago, that's what their lawsuit last year was about, is the lack of, it was like 99% of pedestrian traffic signals didn't have an audible signals. But I think there's important design elements that are needed, research that's needed to understand more about what's needed in the environment, in the pedestrian infrastructure for people who have intellectual and developmental disabilities in terms of navigation and wayfinding, as well as people who are deaf and hard of hearing. And yeah, I think those are definitely overlooked. I think communities come in with looking for the specific steps that they need to do. And because those steps are not kind of built into the design guidelines, they're not necessarily going to think about those as part of their plan and don't think of wayfinding in the same way that they think of a curb cut. But it may be possible that wayfinding is just as important for a person with intellectual disability as a curb cut is for someone who uses a wheelchair. So that's definitely an important area of research that, who knows, one day maybe lead to an amendment to the ADA for requirements of what's needed. Beyond something being a barrier, there's also is the presence of facilitators that could enable equitable access. Yeah, so definitely think that's an important area. I like that question.
Awesome, thank you. And I think that it speaks back to what you said earlier in terms of what does it look like to have meaningful representation from disability communities on these projects and on these initiatives. So thank you again for that.
Yeah, for sure.
And I also just wanted to highlight that if you did want to try to get your hands dirty with Project Sidewalk and start to help map Chicago and other cities with Yochai and John, the event on December 10th will be a hands-on, or I guess computers on a tutorial for contributing to the crowdsourcing of Project Sidewalk. So for those of you who are still with us, please join in one more round of applause for Yochai. And then we will sign off and say goodbye.
Thank you so much for coming on.
Yeah, until December, everyone. Thank you.